Good morning, everybody. Welcome back. It's a great day for this Tuesday, and it's an even better day now because look who is here. It's time for some great advice from our friends at Medicap Pharmacy. Sherry Schmidt is back in the studio with us. Good to see you.
Thank you. It's good to be here.
Nice. And what are we talking about today?
You know, today, Mother's Day is coming up this weekend, so for those of you at home that forgot, this is your reminder.
Here's some things you can buy for mom. Here, okay, looking for some ideas.
But you know, moms, women in general, they tend to wear a lot of hats. You know, wife, mother, grandmother, coworker, sister, friend, whatever it is, and they tend to spend a lot of time taking care of everyone else in their life. And so we just want to thank them for that, but also kind of remind them to take care of themselves. So I thought we'd talk today about women's health and just some kind of general things that women should do and know about every day.
Okay,
so,
that makes sense.
What should we start with?
how about we can, I think I have some routine screenings for women. I have a graphic of that we could put up maybe.
When do those usually start?
You know, it kind of depends on what it is and what the screening is for. 40 is kind of a normal age that we tend to start different kinds of things, whether that's blood pressure or mammograms, but it could be earlier if you have some type of family history, say of breast cancer, or maybe family history of diabetes or blood pressure. You might want to have those things checked earlier as well.
After doing this shift, you're going to need them all.
I know. I think actually, because I finally went to a doctor here recently, and they're like, yeah, you should start that stuff now. And I'm like, what?
They just threw in an ambulance and said,
And they said,
now?
quick, now.
Stuff now? But yeah.
And I think we've talked about on this show before that I think it's always, some women forget that heart disease is the #1 killer of both men and women in the United States. And I think women don't tend to associate themselves with that
You think
disease.
of men with heart disease.
Think of men with heart disease, and women,
Right.
you know, women, you tend to think breast cancer, and not the heart disease. So, and then I just want to remind women that with the heart disease and the heart attacks, women and men don't always have the same kind of symptoms. So men are more likely to have those symptoms where they have you know, the pain in the chest or the radiating pain in the jaw or down the arm, whereas women are more likely to experience nausea, indigestion, just kind of a general
heartburn type
the
thing.
heartburn kind of thing, general kind of not feeling the, you know, it's a different feeling, but they pass it off as lots of different things.
There you go. We have the photo here.
Okay, great. Oh, yeah, this is just, we have a promotion going on in our Medicap stores this month. So it's a women's health promotion. If you come in to any of our stores, we have a women's health guide, and a little secret that you can hear first on Great Day. It has a $5 coupon included in it for over-the-counter items. And I have some different over-the-counter items. We can talk about it first here, though. So I have a quiz. But this is for any women to take, and so to see if they can answer yes to all of these questions. So, you know, sleep is one of the most important things. And
#1 is no.
you guys know this,
I can't read it. What does it say?
It says I get 7 to 8 hours of sleep most nights.
Yeah, no.
So, yeah.
#2 is I have perfect vision.
I have coping skills.
I have coping skills to ease stress, which built up stress.
Is drinking okay? That's how I cope.
In moderation.
Okay, good.
Your good friend Jack Daniels?
Yeah, maybe red wine would be a good choice. It says I keep my weight within a healthy range.
Yeah.
I don't smoke.
Yes.
Okay, you have one. Okay.
I limit alcohol to no more than 1 drink per day or less.
Wow.
There's that coping skill. I eat a balanced, low-fat diet that includes plenty of fruit, vegetables, and fiber.
Wow.
I get 30 minutes of exercise nearly every day, and that doesn't need to be 30 minutes all at once. That can be 10 minutes 3 times a day.
You take the stairs, don't you?
Yeah.
Okay.
So there you go.
That kind of helps.
I partner with my healthcare provider to have regular checkups and screenings.
No.
I protect myself from sun's harmful rays.
I try.
And I take time for fun and friendship. You know, managing stress, we're finding, is stress.
So 1 out of 10.
I'd say 3 out of 10. We'll be generous.
Okay, well,
We'll
3
be
out of 10.
generous.
That's not too bad.
Yeah, there you go.
But
some
that's
things to
kind
work
of,
on.
it's an indicator that, okay, maybe I do need to take care of myself a little bit better.
And I think that's, you know, women tend to think, yeah, I take care of myself, but when you look at that quiz, you're like, okay, well, maybe. I
Some
need
things to think about.
And you're right. Some moms do kind of push those things off because they have busy schedules with kiddos, and it happens, right?
Right, and you tend to think, you know, you make your kids' health a priority, or maybe they're caring for an elderly parent or something like that. There's a lot of other priorities sometimes in our
They
lives.
prioritize everyone else beside themselves.
Right.
Above themselves.
So you did bring a couple things in with you this morning. How can they help with women's health?
So for women, you'd want to check with physicians first before you start taking this, but aspirin is recommended for both men and women as a preventative for heart disease. So I did bring in some aspirin. This is just the 81 milligram milligram baby aspirin. And so, like I said, you'd want to check with your physician because there could be, or your pharmacist, could be some conditions that maybe you shouldn't take aspirin with if you have like ulcers or things like that. But otherwise, you can ask them, and that's a good preventative. I also brought in, this is a relatively new product. It's called Bayer Pro Heart, and it contains fish oil and also some vitamin D. And fish oil has been, there are some studies that have proven that it does tend to support heart health and may be beneficial. And then there's a few studies out there about vitamin D. We know it helps with calcium absorption in the bones, but I think it may play a role in blood pressure as well, and helping maintain blood pressure.
It says there, with ProGel technology proven to reduce fish burps.
I was hoping you would ask me about that. So a lot of people really don't like taking fish oil because they feel like they get this burpy fish
like you
taste.
just done eating sardines.
Do. Right, right. So this is supposed to have a technology to help that. Another little secret is you can store your fish oil soft gels in the freezer, and it kind of forms a little bit of an enteric coat around it, and will help with that a little bit well. So it's dissolved a little lower in the colon instead of a little higher. So
that makes sense.
As far as I know, it would still be effective.
Is it important to take things like my doctor always asks, like, are you taking your vitamin? Are you taking fish oil? Things like that. If you get them, we come to Medicap Pharmacy and we buy them off the shelf, is that really making a difference in our lives? Or you hear other people saying, no, you need the really expensive, like $200 vitamin if you really want it to make a difference? I don't think your body knows, like if you're taking vitamin D, I don't think your body knows where that source is coming from. So as long as it's, I think what you need to know is, are there other impurities in there or other things? But as far as like, vitamins and supplements, I don't think the price necessarily makes a difference on, it's vitamin D or it's fish oil or whatever it is. As long as you're getting it in your body.
As long as you're getting it in your body. And, there may be some technology like this fish oil where it says it can help with side effects. But as far as is the fish oil the same from this one to a cheaper one, I think yes.
Okay. So, good to know.
What else do you have up there?
I also have some calcium. Calcium and vitamin D, that's another thing that most women should be taking. I brought in, there's different forms of calcium. This is calcium citrate, and there's also calcium carbonate. I like the calcium citrate. It's a little better absorbed by the body, and it also tends to cause less gastrointestinal upset.
A little less harsh on the stomach?
Less upset stomach, constipation, gas bloating,
and
things
you said
like
a lot
that.
of the women in your family end up looking like question marks.
Oh yeah, we're known. The Heimsauce are known for their humps. Like all the way from my mom down the line, we all get this wonderful hump, and I can even start seeing, So Mom always tell me, it's like sit up,
and so
stuff
calcium
like that.
and good posture.
Calcium is huge.
And then the last thing I brought was there's a new Citracal product on the market. So this is the calcium citrate, but a lot of women have trouble swallowing the calcium because it tends to be a huge, great big horse pill.
Yeah.
This is a chewable soft gel. They call them calcium pearls, and I don't know if you can read. It sounds like a food item here. It says soft vanilla cream flavored center with a delicate mixed berry flavored shell.
It sounds like dessert.
It's like dessert.
Entice you to take your vitamins and your calcium.
That's some swanky Citracal.
Exactly.
There you go.
So it'll be a little bit more expensive to buy it that way, but if you can't swallow the larger pills, it would be an alternative.
There you go. But if you want to get that checklist, you just go to
the checklist, the coupon. Come to any of our Medicap pharmacy locations. We can also help you pick out any medication or any over-the-counter items, answer your questions. And then, routine health screenings too are covered by the Affordable Care Act for most women. So I think our guide, our checklist has some of those listed. So if you have questions about if you need them or not, you can talk to our pharmacist as well.
Perfect.
Wonderful.
Wonderful. Good seeing you.
Yeah, great. Check us out on Medicap Central Iowa Facebook and Twitter.
Okay.
And happy Mother's Day.
And happy Mother's Day.
All right, it's 8:32. We'll be